Hello, this is Dr. Gadusi, and I'm going to answer a few common questions about the Moderna COVID vaccine, which is what we have available here at Beal. If you're wondering about how the vaccine actually works, please see my other associated video. One question that comes up is, what exactly is in the vaccine? Overall, the components of the COVID vaccine are straightforward. In the vaccine, you have a messenger ribonucleic acid, or mRNA, which is the blueprint for the protein that needs to be made to make an immunologic response. Various lipids, which are a vehicle for the vaccine components to travel. Tromethamine, which is a biologic buffer, keeping the pH at appropriate range, and its other associated salts, along with acetic acid, sodium acetate, and sucrose, which work to maintain the pH and stability of the vaccine. These are simply salts, acids, and sugars that are pretty much like electrolytes you'd find in IV fluids. There are some that are worried about this being an mRNA-based vaccine, which isn't typically seen during a vaccine rollout. However, all components have been around for a long while, and it's just being rearranged a bit. It's like if you were to go to your favorite taco place, and instead of the old favorites like a taco, burrito, / flu vaccine, they took a tortilla, added beans, tomatoes, lettuce, and threw in some turkey for a Thanksgiving spin. Now, if you were to ask the taco place to prove that it's safe, it'd be difficult to do so, because it's new. But you know all the parts are safe, so there's no reason to think that rearranging it like this would increase the risk. To quell some other concerns I've heard, mRNA vaccines don't contain COVID, so it won't give you an active infection. And the mRNA doesn't actually interact with your DNA in any way, as it doesn't actually enter the nucleus of the cells where the DNA is kept. And as discussed before, the mRNA degrades after making the protein. I've heard concerns that the COVID vaccine is being rushed, but this did not affect the quality of the product, and to be blunt, you shouldn't worry more about this than getting a rush delivery for a package. They're still working within the confines of appropriate scientific rigor, just as your rush package isn't being chucked from the truck to your door in order to shave off a few seconds. All that changed with the administrative process, and if nothing else, it actually shows the potential if there weren't as much red tape, and there was more political and financial clout in the development. I've heard concerns about this COVID vaccine not being safe for pregnant individuals and that it might cause significant adverse effects. But the reality is the COVID-19 vaccines made by Pfizer and Moderna contain no live viruses that can directly affect a mother or baby. Of the 15,000 pregnant women who received at least one vaccination dose in the United States, there have been no red flags or adverse events. Please remember that this information is not all-inclusive, and an important part of the medicine is to look at the whole person. And although there are some legitimate reasons not to get the vaccine, like severe allergic reaction to the ingredients, they're very rare and should be seen as an unlikely exception rather than the standard. For more information on the Moderna COVID vaccine, see the insert or get more info at cdc.gov.